the topic of discussion that we are going to have right now is we are going to talk about what fourth cranial nerve. We are going to talk about fourth cranial nerve. In this now, what we'll be talking about the places in which they are placed in what the columns, the nuclei. We'll be talking about origin, how they originate. We'll be talking about what the course, how they are, we'll be talking about how they go into supplying what superior oblique muscle, and these are the things that we'll discuss. So now without delay, let's begin. So here, yes, these fourth cranial nerve, right, fourth cranial nerve, our trochlear nerve, where they are present in fourth nucleus is present in what, in inferior inferior colliculus level. Now where is this inferior colliculus level? What is this? This is our midbrain, right? In this midbrain, what is this? This is our cerebral peduncle, right? These are our cerebral peduncle, the ventral part, and these region, these are our what, inferior colliculus, right? Inferior colliculus. Now these are what? These are our dorsal side or posterior side. Now here, where are these present? These are present at what, close to inferior colliculus level, right? Close to inferior colliculus level. And talking about what, the columns where they are present, they are present in what, our general somatic efferent column, general somatic efferent column. If you remember, general somatic efferent column, these are what, these are column that consist of nucleus, right? That consist of nucleus supplying what, supplying our extraocular muscle, right? Extraocular muscle and our what, hypoglossus, right? Hypoglossus, the one that is supplying tongue. So if you remember, if you recall the points that we discussed in what, this our cranial nerve nuclei and columns, then at the time we talked that these GSE, what it consists of, what it consists of our this cranial number 4 nuclei. Similarly GSA, general our somatic efferent, right? It receives what, proprioceptions from our these superior oblique muscles. Okay, now let's talk about what, yes, we talked about what it lies where, it lies inferior to it lies at the level of inferior colliculus level. Or also we can say, if you remember the lecture on what our this third cranial nerve, then at the time where third cranial nerve was present, the third cranial nerve was present at the level of what, the level of superior colliculus, right? At the level of superior colliculus. But here, now here, what we can say that it is present what, just below that inferior colliculus level, right? Here these are present. And talking about its course, now it will emerge from posterior surface, right? As you can see how they are doing, they are emerging from posterior surface. As I have already mentioned, this is the dorsal side, this is the ventral side, dorsal, this is the ventral, that means this is what, posterior side. It is anterior side. So these are only the nerve, right? These are only the nerve emerging from dorsal aspect, from this dorsal aspect, or from posterior surface of midbrain. Okay, now here, now what they will do is, now these nerve, what they will do is they will dissociate at the level of midbrain only, right? Within the midbrain, as you can see, now what is going on, this fourth nerve nuclei, right, which is present right here, what it will do is it will just go into another side at the level of what, at the level of our this midbrain only, within this our midbrain only. So these dissociate within what, within brainstem, or within our this midbrain. So what is going on, it is dissociating and it is going like this. Now what it will do is, since it is dissociating, right, it is all the way, it is coming from posterior, it is the longest intracranial course, it is having the longest intracranial course, right? Intracranial course. Okay, now moving further, as I'm saying that it is coming dissociating at the level of midbrain, then from posteriorly it will come all the way like this. So it is having the longest intracranial course. Now it will pass between our two arteries. What are these? Posterior cerebral artery, right? Posterior cerebral artery, and our superior cerebellar artery, right? The upper one, it is cerebellar artery, the below one, it is cerebellar artery. Now it will go all the way to what? It will go all the way through middle cranial fossa, right? Now in middle cranial fossa, it will go through cavernous sinus. In cavernous sinus, it will go what, through lateral wall, right, as our third cranial nerve. And after that, what it will do, it will enter what, it will go through our this superior orbital fissure. What is this? This is superior orbital fissure. Through this it will go, right? Through this it will go and it will enter what, it will enter orbital cavity, and in orbital cavity it will supply our superior oblique what, muscle, right? Superior oblique muscle of eyeball. If you remember, what this SO4 superior oblique muscle is supplied by 4th cranial nerve, LR6 lateral rectus is supplied by 6th cranial nerve, and other all muscles are supplied by our 3rd cranial nerve. So this is it. And another thing is, it is the most thinnest and most slender, smallest it is the most thinnest, most slender and smallest cranial nerve. That is one thing. So we talked about what? We talked about the places in what? Columns. We talked about origin, we talked about course, and we talked about some of the facts. So this much for what? Trochlear nerve. Thank you and have a great time.